Hi, my name is Mark Haskins. I'm the Medical Services Officer for the City of Milton.
My name is Derek Hoffman. I'm a firefighter paramedic for the City of Milton and also a part-time CARES paramedic.
So you might want to know, what does a CARES medic do? So Derek, we have about 5 different paramedics that serve in our community paramedicine program, Milton Fire Cares. Maybe you can tell us what a typical day would be like when you work in the CARES unit.
So a typical day, we go over our patients list, see who we have to visit during the day. We have our patients ranked usually by what we call severity, whether they need a visit once a day, once a week, bi-monthly visits, depending on their condition and what kind of chronic diseases they normally have.
Do you try and make like 1 or 2 visits a day, something along those lines?
Normally we make about 2 visits, sometimes 3 visits, depending on how the day goes.
Nice. And the CARES medics will also help me. We teach different medical classes around the city. We'll teach CPR, maybe different classes on disease processes or anything that we feel like might benefit the city. Our CARES medics, they also assist with that.
We show the community on how to treat chronic conditions so you guys can stay at home rather than have to take an emergency visit to the hospital. So we'll teach diabetes classes, how to manage diabetes, how to manage congestive heart failure. We also will teach on how to manage post-cardiac issues such as a heart attack and things that you should be doing in order to prevent you from being readmitted to the ED.
Right, and as Derek kind of mentioned there, what we want to do with this program is make sure that we kind of fill in that gap in between when somebody calls 911, maybe they go to the hospital and then they get discharged and come home and they still have some issues and they don't quite know what to do. They don't know where to turn or who to call for help. So we want to visit these people, make sure they understand what medicines they've been prescribed, understand all the doctor's orders. In fact, we can follow up and FaceTime with maybe the primary care physician of the person, their hospitalist, whatever the case may be. We want to make sure that we give them the proper education and help that they receive when they're home to follow up on care that they maybe received either in their doctor's office or in the hospital itself.
That's right, Mark. We recently just established what's called telepharmacy. So if you have any questions about your drugs that they've been giving you or your medications, we have somebody that we can consult on a whim pretty much while we're visiting you.
Right, there's a pharmacist that's agreed to work with us out of Alpharetta, and so we can call them up and just discuss with them exactly what your questions are on your medication. So that's a handy tool. We're trying to follow up with all the urgent cares. We have some partnerships with a couple of the local hospitals where they give us referrals if you live in the city of Milton and maybe you had to go to the hospital, or maybe your parent, grandparent, family member. There's no age limit when it comes to our service. You can be young, you can be old. We'll try and help out anyone who needs help when it comes to follow-up care. So we've made some agreements with some different hospitals.
We're working with Wellstar North Fulton. Yeah. We have Northside Forsyth, which is one of our bigger partners. We're currently working with Northside Cherokee and Emory Johns Creek to get patient referrals and have them refer you guys to us.
Right. So kind of the whole idea of CARES is just to do individualized care, but also to bring in the education component of it too. We want to make sure that Milton is educated on these different disease processes or just how to live their best life so that they can be healthy, they can live a long life, and if they're having issues, they can have those addressed, right? Nobody wants to have medical problems and not know where to turn or where to find help, or maybe having the proper resource if they need to move into assisted care or whatever. We have all of those referrals, and that's a big part of what Derek does, is he'll make sure they're getting the care that they need, and then also they're referred to the next person that can also help them out.
Correct. We also, there seems to be a misunderstanding within the community that CARES is only for senior folks.
Right.
And we want to clarify that this is programs for everybody. Even if you're you have a 12-year-old discharged from the hospital with a broken arm, have a question about your medication, or you're unsure about the medication or unsure how to take care of them, you can give CARES a call, and we'll come out and assist you.
Right, and it's not like we're gonna come every single day until that person, grows old.
Exactly.
Sometimes it's just that we stop in, maybe it's just one visit, just enough
Yep.
to answer their questions and then help them out.
Yep, this, like Mark was saying, this program's not just for the long term. We do have short periods that we're going to start calling probably the graduation program, where we can stay, just watch you guys over for 30 days, 60-day, 90-day increments, and kind of graduate you on to live your best life.
Right.